Stop doing oral sex. I'm serious. At least stop doing it as foreplay. Oral isn't foreplay. It's called oral sex for a reason. And if you're starting there, you're skipping the one thing that actually gets her body ready. Most men misunderstand foreplay, and this misconception often stops arousal before it even begins. Many assume foreplay starts with direct genital stimulation, but research shows that focusing narrowly on this area can bypass natural arousal pathways. Some doctors warn that initiating intimacy at the wrong place creates a mechanical experience, reducing sensitivity and anticipation. Real foreplay involves engaging the entire body, allowing the nervous system to gradually awaken. Full body contact stimulates touch receptors across the arms, torso, neck, and back, which in turn sends signals to the brain that increase natural desire. Studies in sexual medicine indicate that men over 50 respond more effectively when stimulation is distributed across multiple regions rather than concentrated in one area. Gentle hand placements, caresses, and light massage encourage blood flow and relaxation, which are critical for physical readiness. The body's natural response to touch depends on rhythm and flow, not speed or intensity, and medical experts emphasize the importance of moving gradually from broad contact to more focused attention. Pressure should be responsive, adjusting to the body's reactions, rather than assuming one method fits all. Awareness and presence are equally essential. Research in psychosexual health demonstrates that emotional connection enhances physiological arousal, increasing pleasure and intimacy. Timing and sequence outweigh technique, meaning that the order in which stimulation occurs can significantly affect overall satisfaction. Slow, deliberate progression allows the body to build natural tension, creating stronger sensations when climax occurs. Avoiding rushed or scripted actions reduces stress and allows desire to develop organically. Many men fail to recognize that desire is enhanced through responsiveness, attentiveness, and mutual cues rather than performance. Doctors note that practicing these principles improves arousal, strengthens connection, and reduces the pressure that often interferes with enjoyment. Full-body foreplay, when performed with attention to flow, pressure, and sequence, provides a foundation for deeper intimacy and more satisfying sexual experiences. By focusing on whole-body engagement rather than isolated techniques, natural desire is awakened efficiently, allowing physical responses to emerge in a comfortable, sustainable manner. Developing this awareness encourages men to connect with their partner's body and responses, supporting mutual satisfaction and emotional closeness. Clinical guidance recommends incorporating gentle, varied touch across multiple areas, maintaining eye contact, and moving deliberately through the stages of arousal. This approach not only improves physical sensation, but also promotes emotional bonding, which is a key factor in sexual health for men over 50. Adopting a full-body method respects the body's natural rhythms and can prevent common mistakes that reduce pleasure. Understanding that foreplay is more than a mechanical sequence helps men shift from performance-oriented behavior to connection-based engagement. Studies in sexual wellness confirm that distributed stimulation, combined with presence and attention, increases arousal and promotes longer-lasting desire. Pressure, flow, and timing create a natural escalation that primes the body for sustained sexual response. By following these principles, men can build desire without feeling rushed or pressured, ensuring that intimacy is a shared, enjoyable experience. Medical professionals emphasize that these techniques are not gimmicks or scripts, but educational methods that enhance awareness and responsiveness. Learning to read the body, adjust touch, and progress naturally fosters more satisfying encounters. Full-body engagement promotes a harmonious connection between partners, making physical arousal stronger and emotional intimacy deeper. When practiced consistently, these habits reduce frustration, increase responsiveness, and improve overall sexual health. The combination of awareness, proper sequencing, and gentle varied stimulation allows arousal to emerge naturally, supporting both physical pleasure and emotional closeness. Implementing full-body foreplay encourages men to approach intimacy thoughtfully, prioritizing connection over performance and creating a more fulfilling sexual experience. Clinical advice confirms that slower, attentive stimulation maximizes sensitivity and enhances mutual satisfaction. Awareness of touch, timing, and bodily cues ensures that desire develops organically. Engaging the entire body in foreplay activates multiple sensory pathways, creating faster arousal and stronger sensation. Incorporating flow and pressure allows responsiveness to guide actions, rather than relying on fixed techniques or preconceived sequences. Proper pacing respects the natural physiology of men over 50, who may require more gradual stimulation to achieve peak arousal. Maintaining presence and connection amplifies sensation and reinforces emotional intimacy. By focusing on full-body interaction, timing, and attentiveness, men can experience more satisfying, connected, and enjoyable sexual encounters without relying on performance or scripted routines. Full-body contact awakens physical arousal naturally by engaging multiple regions of the body simultaneously. Touching the shoulders, back, neck, and torso activates sensory nerves that send signals to the brain, gradually increasing physiological readiness. Some doctors note that men over 50 often experience slower or less concentrated arousal, making broad, full-body stimulation particularly effective. Research in sexual health shows that distributing touch across the body increases blood flow and heightens sensitivity, creating a more organic buildup of desire. Gentle massage and caresses release tension, which can enhance responsiveness and prevent premature fatigue. Full-body contact also stimulates the parasympathetic nervous system, promoting relaxation and allowing the body to respond without stress or anxiety. Studies in psychosexual medicine indicate that attention to multiple touch points can increase the release of hormones associated with pleasure, including oxytocin, which strengthens emotional connection and intimacy. Engaging the entire body rather than focusing solely on the genitals supports natural arousal pathways, producing stronger, more sustainable sensations. Experts advise maintaining slow, rhythmic movements to preserve flow, ensuring that the body remains receptive and responsive throughout. Adjusting pressure according to the partner's reactions further enhances stimulation, as overly firm or light touch can reduce effectiveness. Full-body contact also encourages mutual responsiveness, allowing each partner to communicate comfort and desire non-verbally. Clinical observations suggest that men who incorporate full-body techniques report more consistent arousal and increased satisfaction, particularly when combined with attentiveness, timing, and flow. By stimulating multiple areas, the body naturally integrates sensations, leading to more intense and lasting pleasure. Full-body engagement activates both physical and emotional channels, reinforcing intimacy while preparing the body for deeper sexual response. Medical guidance emphasizes that this approach should be deliberate and mindful, avoiding rushed or mechanical actions. Gentle touch across broad areas primes nerve endings, gradually awakening the body to heightened sensation. Integrating arms, torso, and shoulders into foreplay improves circulation and energy flow, supporting natural sexual responsiveness. The combination of full-body touch and attentive rhythm allows arousal to build organically, making the transition to more focused stimulation smoother and more effective. Experts in sexual medicine recommend practicing full-body engagement regularly, as it strengthens the body's awareness of touch and responsiveness. By emphasizing connection, touch variety, and presence, full-body foreplay enhances pleasure while reducing anxiety and performance pressure. This method respects the physiology of men over 50, accommodating slower response times and promoting sustained arousal. Activating multiple sensory pathways simultaneously allows the body to experience heightened excitement without overstimulation. Research shows that when full-body contact is used consistently, both partners experience increased sensitivity, deeper sensation, and stronger emotional bonding. Incorporating these practices into regular intimacy fosters natural desire, and prepares the body for a more satisfying sexual experience. Gentle, attentive touch across multiple regions maximizes pleasure while supporting the emotional connection critical to long-term sexual health. By focusing on full body contact, men can awaken arousal naturally, creating a more responsive, connected, and fulfilling intimate experience. Eye contact and presence are essential components of effective foreplay, directly influencing arousal and emotional connection. Maintaining steady eye contact signals attention, desire, and emotional engagement, which can significantly enhance physical response. Some doctors warn that ignoring eye contact can make intimacy feel disconnected, reducing natural arousal even if touch is present. Research in sexual psychology indicates that visual connection between partners stimulates neurological pathways associated with desire and bonding, increasing oxytocin levels and reinforcing emotional closeness. Over 50 men often benefit from this awareness, as the combination of physical touch and visual engagement amplifies the body's responsiveness. Presence involves being fully attentive to the partner's signals, movements, and reactions, rather than rushing or performing. Studies in psychosexual health emphasize that when men maintain focused awareness, both partners experience stronger sensations and a deeper sense of intimacy. Practicing presence means adjusting touch, pressure, and pacing in response to subtle cues, creating a dynamic and interactive experience. Eye contact also supports communication without words, allowing partners to convey consent, comfort, and desire naturally. Clinical observations suggest that couples who integrate consistent eye contact report higher satisfaction and more synchronized arousal. Incorporating presence reduces performance anxiety and fosters mutual enjoyment, particularly for men who may experience slower or less predictable physiological responses with age. Experts recommend beginning foreplay with gentle eye contact while engaging in full-body touch, maintaining a flow that encourages both emotional and physical connection. By combining awareness, attention, and visual engagement, arousal develops more organically and becomes easier to sustain. Eye contact paired with presence allows the body and mind to align, creating a harmonious experience that strengthens both desire and intimacy. When practiced consistently, these techniques enhance pleasure, emotional bonding, and overall sexual health, supporting a more satisfying and responsive experience for men over 50. Rushed sequence during foreplay can significantly reduce arousal and overall satisfaction. Moving too quickly from initial touch to focused genital stimulation often short-circuits the body's natural response, leaving the nervous system unprepared and the mind disengaged. Some doctors warn that this is one of the most common mistakes men over 50 make, as slower physiological responses require deliberate pacing. Research in sexual medicine shows that gradual progression allows blood flow to increase, nerves to become more sensitive, and anticipation to build, resulting in stronger, more sustained arousal. Skipping steps or accelerating touch can make the experience feel mechanical, reducing both physical pleasure and emotional connection. Experts emphasize that timing is more important than technique, as the order and duration of stimulation determine how effectively the body responds. A well-paced sequence encourages the release of hormones like oxytocin and dopamine, which enhance bonding and pleasure. Men who maintain a deliberate, attentive progression from broad touch to more focused stimulation often report increased satisfaction and more intense climax. Clinical guidance recommends observing partner cues and adjusting timing according to their responses rather than following a predetermined pace. Rushed actions can trigger stress or performance anxiety, interfering with natural desire and decreasing responsiveness. Incorporating gentle caresses, full body contact, and gradual escalation allows both partners to remain present and engaged, fostering stronger emotional intimacy. Experts advise practicing patience and awareness, focusing on connection and responsiveness rather than speed or efficiency. By respecting the body's natural rhythm and giving arousal time to develop, men over 50 can enhance pleasure, intimacy, and overall sexual health, avoiding the common pitfalls associated with hurried foreplay. Breathing and flow are central to effective foreplay, as they directly influence arousal and bodily responsiveness. Coordinated, deep breathing helps regulate the nervous system, promoting relaxation and reducing tension, which are essential for men over 50. Some doctors note that shallow or irregular breathing can inhibit blood flow and decrease sensitivity, making physical response slower or less intense. Research in sexual health demonstrates that synchronized breathing between partners can increase connection, enhance oxytocin release, and improve overall pleasure. Flow refers to the rhythm and continuity of touch, movement, and attention throughout foreplay, allowing stimulation to build naturally without abrupt interruptions. Maintaining a smooth, gentle progression helps the body anticipate pleasure, strengthening arousal and prolonging sensation. Experts recommend combining slow, deliberate breathing with continuous attentive touch to keep the body engaged and responsive. Variations in pressure, movement, and touch, guided by partner feedback, further support flow and prevent overstimulation or numbness. Clinical studies highlight that men who integrate mindful breathing and rhythmic movement experience stronger physical sensations and heightened emotional connection. Synchronizing breath and touch also reduces performance anxiety, enabling more relaxed and authentic interaction. Over 50 men benefit particularly from this practice, as it supports circulation, sensitivity, and endurance. Developing awareness of breath and flow encourages presence, ensuring that each stage of foreplay contributes to gradual arousal rather than forcing a premature climax. By focusing on breathing and maintaining consistent flow, physical and emotional engagement strengthen simultaneously, creating a more satisfying and intimate experience. Experts advise practicing these techniques regularly, as they cultivate natural desire, improve responsiveness, and enhance overall sexual health, making foreplay both more enjoyable and effective for men over 50. Touch variety stimulates multiple areas of the body, enhancing arousal and maintaining interest during foreplay. Using different types of touch, such as light caresses, gentle strokes, or firm pressure, activates a wide range of nerve endings, sending diverse signals to the brain that increase sensitivity and pleasure. Some doctors emphasize that over 50 men often respond better when stimulation is varied, as it prevents desensitization and encourages sustained arousal. Alternating between areas like the arms, shoulders, chest, and back engages the entire body, reinforcing full body connection and emotional closeness. Research in sexual medicine shows that touch variety also enhances anticipation, prolongs sensation, and supports a gradual buildup toward climax. Adjusting pressure and movement according to partner cues ensures comfort while maximizing responsiveness. Incorporating a mix of gentle and more focused touch stimulates different sensory pathways, promoting natural desire without relying on rigid techniques. Experts note that varied touch keeps the experience dynamic and engaging, strengthening both physical arousal and emotional intimacy. Practicing touch variety encourages attentiveness and responsiveness, making foreplay more enjoyable, effective, and satisfying for men over 50. Experts recommend practicing attentive progression, combining full-body touch, flow, and presence to build desire organically. By prioritizing timing, men can sustain arousal, deepen intimacy, and create a more satisfying and fulfilling sexual experience.